All right, this debate over school lunches goes way beyond what foods your kids are eating in the school cafeteria. It's also about how much control the U.S. government has over states and local school districts that need federal money to feed students, many of them from low-income families. Jeff Stier is a senior fellow at the National Center for Public Policy Research who studies national lunch programs. He says they are ineffective and not worth the money. Now, Jeff, obviously they're not ineffective insofar as they give kids who are low-income calories that they're not otherwise getting.
We actually saw that the kids were throwing away their food and they weren't buying it.
Right, but you're saying the healthy part of it is this idea of feeding them more food, but the program itself is not ineffective.
Well, it depends on how you administer the program. Michelle Obama's plan spawned a hashtag, thanks Michelle Obama. Kids were taking pictures of how unappealing this food was.
Right.
They weren't eating it, they were wasting it, and then they were going out and getting fast food.
Right.
So it's not just about freedom,
right.
It's about what works. There's no question obesity, childhood obesity is a very serious problem. The question is, should we just throw ideas out there and see if they work, or should we perhaps consider some science first?
Right. I will tell you that if you make it really easy for me to eat unhealthy, high-sodium, deep-fried foods, I would probably do it at almost every meal, and I'm an adult who knows the science behind it. So what's the bad thing about keeping this a little out of the reach of kids?
Well, if you go to the Texas example, I think that's a perfect case where there's a learning opportunity inside school, imagine that, where kids can be taught how to make choices and include a fun food sometimes.
Right.
If we make these foods forbidden, kids won't eat the healthy lunches, we've seen that. They'll go out to the fast food restaurant without any supervision and go crazy. So what I'd like to see is kids having choices in a supervised environment where maybe there are teachers or nutrition instructors at the schools who can show them how to actually make choices. When you say you can't have this at all, that's not working.
I feel like the last people who willingly chose an apple over something else were like Adam and Eve. You know, kids choose sugary stuff. They choose fatty stuff, generally speaking, right? So does this education idea really work?
Well, that's exactly why we need to educate kids. If we take away all choices, when they get out there and can make their own choices without supervision, that's when bad things happen. So I think kids should have a choice in school to eat some foods that aren't the most healthy food all the time, but do it in a supervised environment so they can learn.
Okay, well, a recent study by the USDA showed that students attending schools that do meet these federal nutritional guidelines are eating healthier compared to those who don't. And David was just saying that there are studies that indicate that proper nutrition can improve a child's behavior, their attention span, their school performance, their cognitive development. At some point, there's a winning side to this and there's a losing side to this. Why aren't we all siding with the winning side?
Because all too often we say, hey, let's solve this problem with more government money, more restrictions, more taxes on soda, et cetera. Problem is, these things don't always work. I'll give you an example. In Philadelphia, the federal government paid to put refrigerators in convenience stores so they could have more fruits and vegetables. How can you be against that? Except these convenience stores already had refrigerators. They were selling beer. People wanted to go out and buy beer. They didn't want fruits and vegetables. You know, the way markets work is if people want something, the stores will stock it. So the problem is not throwing money at a problem by handing out refrigerators in convenience stores in Philadelphia, but actually teaching people perhaps how to cook at home.
The fact is, what you're talking about is educating students in schools. Isn't this just another way to do that? You give them the better choices. I mean, we're not banning kids from eating what they want to have.
Giving them the better choices is just code language for giving them no choices. I think we ought to give kids...
How much of this is about, in Texas, they're carrying on about freedom? How much of this is freedom versus...
You know, I think freedom matters, but I think it matters for a reason. I think freedom matters because when young adults grow up, we have to learn how to exercise freedom responsibly.
We don't let them buy cigarettes.
We
don't let them buy alcohol.
But I think, those are never appropriate for kids.
One might make the argument that if they want cigarettes, the market will say kids are going to get cigarettes.
You're right.
But fewer children smoke as a result of restrictions on smoking.
Of course, but I will argue that a soda, even with sugar in it, is different than a cigarette because it is never, ever appropriate for a child to smoke a cigarette. I would argue that
we didn't all feel that strongly.
But I would argue that it is okay for a child to enjoy a soda, even with sugar, every now and then. The challenge is to teach them how to do it responsibly. And by forcing them out of the schools, kids will never learn.
But you'll agree with me that teaching kids about smoking was to some degree effective.
Absolutely.
Not allowing kids to buy cigarettes was more effective. Increasing taxes on cigarettes and making them unaffordable was more effective.
It was, but I would say that it's wrong to equate cigarettes with soda. I think that's part of the problem. Is everything is the new tobacco. Now things are becoming the new soda. Everything.
Seatbelt laws, is that the new tobacco? I mean, we do these things as we evolve as thinkers, right? I mean,
Absolutely.
don't we? From the time that you and I were kids to now, we have a different understanding of food and its effects on us.
But I think we ought to make sure that science guides that policy. All too often, when you buy refrigerators for convenience stores in Philadelphia, when you decide that.
But what if the science says that fried foods are less healthy for you than the federal nutritional guidelines?
There's no question that they are. That's not the point I'm making. The point I'm making is how do you change people's behavior in a positive way while still protecting freedom, even though it's children's freedom, families' freedom, communities' freedom. How do you effectively make those changes? I would argue that the nanny state approach has not been working.
Jeff, good to see you as always. Thank you for coming and talking to us. Jeff Stier is he's the senior fellow at the National Center for Public Policy Research, and he's the director of the Risk Analysis Division. Good to see you. Up next, the long arm of the law in the United States reaches overseas to indict executives of the